Attending clinic during your pregnancy is absolutely necessary, and I can't stress this even more. It is absolutely necessary. So when you discover you're pregnant, please make an appointment with your gynecologist or your midwife, and depends on the facility that you will go to. So most private hospitals will have a gynecologist, obstetrician, and other clinics you will go to, especially in public sector, you will find a midwife. All these people are qualified to look after you when you're pregnant. So start as soon as possible. It is absolutely necessary. And the importance of attending clinic when you're pregnant is because there are certain medical conditions that may be picked up when you're pregnant, and we want to prevent or allay these medical conditions so that you do not have any complications when you're pregnant and have a healthy baby when you're done with your pregnancy. Antenatal visits are going to be catered depending on the type of pregnancy you have. So if you have a low risk pregnancy, meaning you are having a normal pregnancy that doesn't have any issues, you're doing well, your blood pressure is normal, your scans are normal, you've gone for your glucose tests and they're all normal, and there are no other complications or complaints that you have, then we consider that to be a low risk pregnancy. And low risk pregnancies can be catered to the patient as well as what the doctor desires. So what is appropriate? If you go to the rural hospitals, then we normally, when I worked in government, we actually did 4 comprehensive visits. Now, these are not visits whereby the mother comes and we have a 5-minute conversation. Comprehensive is the key word. So they're very important questions, and there's normally a checklist that we use to make sure that we have asked you enough questions to confirm that your pregnancy is uneventful. Then there are those who have high-risk pregnancies. So for example, there are danger signs in pregnancy or complications that one can get in pregnancy, and then we may have to cater your visits, and they could be more frequent. So if you have high blood pressure in pregnancy, if you have diabetes in pregnancy, if maybe you come and say, my baby is not playing very well, or you're bleeding in pregnancy. Bleeding is the number 1 danger sign in pregnancy. If you're having convulsions, you may have had a convulsion, or you fainted, or maybe you're having excessive vomiting or nausea, or maybe you did a scan and the previous scan told me there's a problem and I need to follow it up, then we will cater the visits depending on the type of pregnancy you have. Some visits could be as frequent as twice a week. So do not get angry or mad at your doctor for telling you need to come twice a week, because they are important. At the end of the day, I want to make sure when you leave the hospital is you have a healthy baby and a healthy mother. So if you're having a low risk pregnancy, clinics can be spread out between 4 to even up to 6 weeks. But once you get to 36 weeks, I may want to see you between 10 and 14 days up to delivery. But depending on the type of pregnancy, the doctor will decide on how many visits you should have.